Going to take you live to Brisbane now, where Queensland health authorities are providing a COVID update. Let's listen in.
COVID care in our hospital system, and of course we have many more people now being cared for in their home under our new monitoring people in their home. Remember, we've got information on the website of how to plan for you getting COVID, how to prepare for it, and also how to monitor your symptoms when you do test positive. We've had 33,312 tests in the last 24 hours, and we are now at vaccination rate of 90.76% first dose and 86.82% second dose. We are creeping slowly towards that second 90% double dose, but we do need people coming out and getting their vaccination on time. Now, I do want to remind people there is very long lines at our testing clinics across the state right now. We've had a number of private pathologists who have not been open over the Christmas period. Some of those will reopen today, and I can advise that our website has shown that private pathologists were to be open today, but we have been advised overnight that in fact a number of private pathologists are not opening at the moment. So there are 5 4-site drive-through sites that are not going to reopen until the 9th of January. That's at Deception Bay, Ipswich, Goodna, Ipswich South and Britannia. There's 8 QML drive-through sites that are not open today, and we're still trying to get clarification from QML when they expect those drive-through clinics to be able to be reopened. I understand that's got to do with around staffing issues, QML have advised us, and we've got 4 Sullivan Nicolaides sites that are not open at the moment due to Sullivan Nicolaides, as I understand, have been engaged by the Commonwealth to go into residential aged care facilities and to do testing there where there's been positive cases. So we know this is putting a strain across the whole testing system, and we do ask for people's patience. I do want to remind people there should only be 3 reasons you come forward and line up for a PCR test, either through drive-thrus or walk-up testing. That is, that you have COVID symptoms. That is one reason to turn up for a PCR test. Secondly, that you have done a rapid antigen test and it's come up positive, you should be coming forward to get a PCR test. And thirdly, you are a household close contact and it is day 6 and you haven't been able to get a RAT test. You can come forward to a PCR test. Now, I can advise we've got 500,000 rapid antigen tests that have arrived in our distribution centre. From tomorrow, we will be dispatching those across our various public testing sites. It will take a number of days to get them out into the regions and across Queensland, but we will make sure that we get these rapid antigen tests to every one of our public testing clinics over the next few days. So as people turn up to testing clinics, they may start seeing over the next few days a separate line. That separate line will be for household close contacts for their day 6 test. They will be able to, instead of lining up and waiting for a PCR test, to collect their rapid test and take it home and test themselves at home. But this will take a few days to get these to all of our sites. So please be patient, but if you are a day 6 test, you may see these lines forming over the next few days. We hope that a number of these private pathologists will be able to come online as quickly as possible to help ease some of these pressures that we're seeing. But I want to give a big shout out to all of our staff and our volunteers who are working these testing clinics, and also to the public for their patience. We know they are long lines. Make sure you're taking water with you, you're preparing for waits at these sites. We know it's important, and I do remind people it should only be for those 3 reasons you come out to get a PCR test, not because you're a close contact in the workplace or you've gone to lunch with a friend. If you don't have any symptoms, that's not a reason to turn up for a PCR test.